Great. Good afternoon, everyone. Can anyone hear me okay? Yeah, okay, great.
Yeah, I can hear you.
Yeah, great. All right. Well, thanks for signing in, everyone, and joining our Quality Improvement Program webinar for April. Um, my name's Dr. Ted Everson. I'm a medical advisor at the CPSO. I work within our quality programs and have a focus within our QI partnership program. We'll start with some introductions and I'll pass it over to my colleague, Dr. Manno.
Thanks, Ted. My name is Dr. Mary Manno. I'm a family physician by training, and I've been working at the college in the QI program since 2019, which is a pleasure. And I'll pass it along to our director, Mary Bailiff.
Hi, everyone. Good morning. I'm Mary Bailiff, and I'm the Director of Quality Programs here at the college. Welcome, and I'm happy to see you all here today.
Thanks, Mary. And there's also we have April Jacobs, the manager of our quality programs, that is supporting our webinar today. April and Mary will be tracking the questions. So during the course of the presentation, if you want to insert some questions into the chat, we'll be tracking those, and I'll go over the format, but we will be kind of trying to save up the questions for after this initial slide presentation. We do have a guest as well today, and we have At.Elisabeth Normand from the CMPA joining us. I'll provide a bit more detail on Elizabeth's background in a couple of slides. So she'll be co-presenting on some QI options that the CMPA has available for physicians as well. Just to go over the format today, we have some initial slides that we will go over, probably 35 minutes of slides talking about our CPSO Quality Improvement Program. Elizabeth will speak to the CMPA's quality program options for physicians. As I mentioned, we'll try to reserve and have a Q&A period at the end. We'll track the questions and then we'll open it up as well. Something new for this month's webinar is that we do have, as I mentioned, a guest presentation, and going forward, we'll look to incorporate that as part of our webinar series and invite other guests to speak and present on how what quality supports are available for physicians that want to do quality improvement. As well, we will be recording this webinar, and it will be located on our website so you can reference it going forward. The objectives for today's webinar, we want to talk about the CPSO transition from quality assurance to a quality improvement approach for our quality program options available to physicians to meet their requirements. We will review the available online tools that we have for physicians to support them with self-directed quality improvement. And we will provide an overview on the current state of the QI program options that are available to physicians. As well, the CMPA will be presenting on initiatives that they have that can support physicians doing quality improvement. Further to that, we have our guest, At.Elisabeth Normand. I'd just like to provide a brief biography of Elizabeth for when she'll be speaking. Elizabeth is a registered nurse that specialized in critical care and also holds an MBA. At the CMPA, she contributes to leading edge education and coaching for physicians and other members of medical teams across Canada to promote the provision of safe medical care. In 2019, the Royal College of Physicians and Surgeons awarded the CMPA Commitment to Change program with the Royal College CPD Provider Innovation Award, recognizing her work. Elizabeth is passionate about education and quality improvement, and we look forward to her presentation on the CMPA test result follow-up workshop and Commitment to Change program and how that can intersect with the QI program that we have at the CPSO. I'll start with some background on our quality programs at the CPSO and just how we've made the transition from a peer assessment quality assurance program to offering QI-based programs for physicians. This slide shows the principles that we use for the work that we do at the college, and whether it's involved in an individual physician matter or in an area that's important to medical regulation. Some of the important principles include continuous improvement, system collaboration. We want to have meaningful engagement with our physician members, and really trying to support the provision of high-level quality care by physicians in the province of Ontario. The other principle there that I'll make specific mention to is something called right touch regulation. And this is something that we use as a principle, whether it's related to an individual physician matter or within our quality program work and the redesign that we've done. And what right touch regulation is, it is really a framework and an approach to a particular area that we're involved with. Right touch regulation is based on an evaluation of risk. It is intended to be proportionate and outcome focused, and it really supports determining our appropriate level of involvement in a particular file or matter or in an area. So when we did undertake a redesign of our quality programs, this is something that we incorporated into the redesign of what we're offering physicians. Some further background on quality at the CPSO. Quality requirements are based within the quality assurance regulation and indicates how members must participate in quality. Now, historically, this was done through our random peer assessment program, and this program was designed on a 10-year interval. And this program had been in place for a number of decades. Based on our experience with the peer assessment program and based on evolving literature on the benefits of quality improvement, we undertook a redesign of our quality program options and have introduced QI-based options for most members. Now, peer assessment is still an important tool for the committees at the CPSO and still exists. An example would be for our members age 70 and over, undergoing an age-related peer assessment every 5 years. Our experience with our peer assessment program, which is a quality assurance or audit-based approach, we were doing approximately 3,000 assessments a year. And with those assessments, approximately 90% of them, there were no problems or issues that were identified. And in fact, in the 10% where there was something, the majority of these were lower risk or lower level issues. And so when we look back and reflected on this, this was incorporated into our redesign and taking a different direction with a QI approach. We know that the majority of physicians in Ontario are practicing at a really good level. And another consideration was the experience, and certainly a number of members undergoing a peer assessment did find it more of a stressful experience, and again, not finding necessarily a lot of value, or really there was no change or significant impact on their practice after a peer assessment. And so with our redesign, we built our redesign on that experience, and this slide outlines the potential benefits of quality improvement versus the quality assurance or audit-based approach. So with a quality assurance approach, which is determining if someone is meeting a minimal acceptable standard, there is typically action or an impact on a small number of individuals. Whereas with a quality improvement approach, there is the potential to have a significant or broader effect on a larger number of individuals, and therefore a bigger impact on overall quality. And this is taken into consideration for our redesign. One additional slide on the background and comparison of a quality assurance program with a quality improvement program. So a quality assurance program is really assessing if an individual is meeting a minimal acceptable standard. It's looking at care that is provided in the past, and it's been done with us by a peer assessor. Whereas with a quality improvement approach, this is a more proactive approach. It is based on direction and a self-guided process of learning, measuring, and improving. It can impact care yet to be provided. And what you'll hear about is that we do offer coaching and support as needed for our members that are doing one of our quality improvement programs. And we'll speak more about that very soon. So at this stage, I will pass it over to Dr. Manno to speak more about the current state and start with our QI program for individuals.
Thanks, Ted. The QI program for individuals got rolling in 2019 when 260 family physicians volunteered to participate in the pilot. And that led to a rollout in 2020, during which time 1,700 family physicians were invited to participate in the program. In 2021, 6,000 members were invited, and that was extended to family physicians as well as psychiatrists, radiologists, internists, anesthesia surgeons, etc. In 2022, we have 4,000 members invited into QI for individuals, and we've also developed a group subset of this program so that we'll be able to encompass a variety of practice settings and specialties. Next slide, please. Ted, I'm just going to go back for a moment to QI for individuals. I think that I neglected to make the distinction within the QI program between the two streams that we offer. One is QI for individuals and another is QI partnership. I'm the medical advisor for the individual stream, and Ted is the medical advisor for partnership, which relates more to hospital-based physicians. And so I should have just clarified that earlier on, maybe that we missed a slide somewhere in our generative process here. Not to worry. I think we're ready now for the next slide. And this is focusing then on QI for individuals. As opposed to the previous peer assessment model, our goal now is to get around to every practicing physician in Ontario on a 5-year cycle. So that's over 30,000 of us that will be invited into QI every 5 years. And the program is conducted online. We have a number of quality improvement activities that are housed online. And you'll see on the far left of this slide, the 3 activities that are made up that constitute the online program housed in a section called the Learning Management System, or LMS. And that includes practice profile, self-guided chart review, data-driven QI. Those 3 activities are completed by individual members, and there's an opportunity to save your work in a PDF format, so you can go back to it later and take a look at what you thought at this point in the 5-year cycle, and maybe compare it with where you want to be or where you go in the future. Those activities are for the members' benefit. They are not submitted to the college, although we do record that they have been completed, and it is a requirement to complete those 3 activities. Next comes the practice improvement plan, which is also an online opportunity to identify your own strengths and weaknesses in your practice and to set a minimum of 2 and a maximum of 4 improvement goals using SMART criteria, which we can talk about in a moment. That's the piece that's the nugget that gets submitted to the college and will be reviewed by one of our QI coaches. And in turn, written feedback will be provided to each member in relation to their practice improvement plan. Next slide. A common question that we're asked at the college is, where do these improvement goals come from? How do we get these improvement goals? Yeah, they probably are not in a cabbage patch. Next slide, please. If you're thinking about the online QI activity practice profile, it's an activity that helps us look at some of the risks associated with medical practice. For example, this physician, I'm a solo physician over the age of 60. Before completing this activity, I did not appreciate the impact on patient care and had no idea that I was at increased risk of a college complaint by virtue of being a solo physician over the age of 60. And that's not because we are practicing ageism here. That's because statistically, being a solo physician over the age of 60 is a risk factor. So this person's goal for improvement centers around mitigating this risk and obtaining collegial support for their practice of medicine. So in forming an improvement goal stemming from this practice profile, the current state for the individual may be that they have little or no peer support. They have an opportunity to structure an intervention and describe it in their practice improvement plan, which could be any number of interventions, but this person chose to rejoin their PBSG group that they had previously participated in through the Foundation for Medical Practice Education. Also made a decision to apply for affiliate privileges at their local community hospital and asked for an invitation to join their local WhatsApp group where other family physicians are reaching out and providing support, especially important during pandemic times. And then the way that this person was going to measure the outcome of the intervention was to look at the future state. So in 3 months' time, the physician is going to reevaluate their level of peer support. So this is an example of how one of the activities embedded in the QI program can stimulate a member to form a goal for improvement. It's one way that a goal for improvement can be born. Next slide. There's an additional online activity which consists of self-guided chart review, in which you'll be directed to choose 5 charts that represent a typical patient interactions in your practice. And you'll be provided with a checklist that will allow you to score those patient records according to accepted standards for record keeping. And also encouraged to obtain feedback from a trusted peer with respect to your record keeping, because that certainly will lend an element of objectivity to this activity. So just to give the feedback about this particular member, when we went over the results of my self-guided chart review, my trusted peer noticed that I often neglect to include negative findings in the record. For example, a 65-year-old smoker, probably you want to add in your physical examination that the abdominal aorta was not palpable when that person presents with abdominal pain. So in this person's case, this member would like to form a goal around improving their record keeping. Then the current state, or the baseline, is 3 out of 5 charts that were reviewed did not include significant negative findings. The intervention that the physician has in mind is to set a reminder, could be electronic or other, to document negative findings in the course of his or her day-to-day work. And the outcome measure would be to conduct another chart review after a period of 3 months of intervention and see whether an improvement had occurred. So this is another example of how practice level data can be obtained from the self-guided chart review, and that data can be used to inform an improvement goal. Next slide, please. The third online QI activity is data-driven quality improvement. And this is a way for us to think about the sources of data that may be pushed to us from third parties, or data that's available to us through observation of our own practice or from our EMR. For example, a member commented, "I had no idea all that data was being pushed to me." That person can use a screening activity report to create a goal, or embed their I4C dashboard into their EMR and mine data from their own patient population in that way. I can also observe my own practice and think about the pebble in my shoe, that thing that kind of niggles at us as we're going through our day. So these are some of the issues that members have identified. My counseling sessions run late 50% of the time. My patients have to wait 2 months to see me in consultation. I'm a locum. How do I get feedback on my performance? 25% of patients were prescribed opioids and may benefit from deprescribing. So these are all ideas for improvement that can generate an improvement goal that one expresses in the practice improvement plan. Next slide. Physicians are also interested in their own health and self-care, especially during pandemic times. And one of the goals in the PIP is allowed to be and encouraged to be relating to physician health and well-being. So this physician looked at CMA resources online and realized that he or she could structure a self-care goal for themselves. For example, I'll leave my office for 30 minutes at lunchtime, at least 3 out of 5 days a week. Maybe to go for a walk or do some stretching or eat lunch, but it's something that's consistent with a well-formed plan to enhance their own well-being. I'll keep track on a calendar of their ability to carry out and check mark each day that I succeed. And after a month, I'll count my successes and reward myself accordingly. This could be an example of a self-care goal. Next slide. In the majority of cases, once the practice improvement plan has been submitted to the college, the written feedback will indicate that the requirements have been met for the coming 5 years. I should point out that having submitted your practice improvement plan, it's not required that you will have carried out the plan completely, because some goals, for example, improving one's PAP screening rate, could take 18 months or 2 years to accomplish. What we want to see is a well thought out and described plan with a timeline in place. It doesn't the project itself does not have to be completed at the time of submission. What we're finding is that in 15 or 20, even 20% of cases, some of the practice improvement plans that have been submitted, there are opportunities for them to be enhanced or improved. And so we do offer coaching to help members further develop their QI goals. And these can be related to clinical care, practice management, or wellness issues that have been identified during the PIP review. Next slide, please. So I'd just like to take a moment to talk about the innovation that has been put into place during 2022, which is the groups subset of the QI for Individuals stream. Next slide, please. So in 2021, 4 groups volunteered to participate in a pilot of this process. And in 2022, we now have 80 groups participating. And so the way this works is that when a member is selected to participate and receives an invitation from the college, he or she has the option to invite up to 6 colleagues to participate along with them in developing a group practice improvement plan. And we've set the number at 7 in terms of the size of the groups, because that's a number that we can facilitate with ease given our own infrastructure. And one of the individuals would become a QI lead and take some responsibility for managing communication with the college and amongst the group members. Each member of the group completes the 3 practice QI improvement activities that I outlined earlier: the practice profile, self-guided chart review, and data-driven QI. Those activities are done individually online by each member, and then the members come together to develop a group practice improvement plan. So most elements remain the same as QI for individuals, but the difference is that the physicians submit one group PIP instead of individual PIPs. Next slide, please. And I'm going to pass it over back to Ted now, because he's going to talk about the partnership stream of our program.
Great, thanks, Mary. So the QI Partnership Program is another new option for physicians to participate and interact with our quality programs, and it is an option for hospital-based physicians. Just to update and reset on the current state, Mary has spoken about our QI for Individuals program in the group subset. And now I'm going to speak about another option, which is our QI Partnership Program for hospital-based physicians. And one of the common features is that these programs are now on a 5-year interval. So the expectation going forward is participation in one of our quality programs every 5 years. The QI Partnership Program, again, is designed to try to engage physicians in doing quality improvement because we know that QI is a great way to change or improve clinical practice. And in the context of the partnership program, the goal and the hope is that physicians will use this as a way to support important work in their hospital. So whether it's something within their organization's strategic plan, maybe it's something in terms of a quality theme or quality metric that they want to focus on. Maybe there is some initiative that they want to launch. This is a potential option as a way to engage physicians in the participation of that initiative. Another item that we wanted to incorporate into the design of the partnership program is that we recognize that many hospital physicians are already engaged in various quality activities, and we wanted to have an option that recognized this and avoided some of the duplication of effort and commitment to all of the various requirements that we have as practicing physicians. So the QI Partnership Program is an option for physicians to participate in a hospital QI project with their colleagues. And by doing that, they will be eligible to fulfill their CPSO quality requirements for a 5-year period. These physicians in this program are still expected to do a couple of the QI activities that Dr. Manno outlined. So there's 2 of them that we asked physicians in the partnership stream complete, and they receive access to as well. And again, the QI project that an organization would submit is something that is aligned with their organization's strategic direction or something that's important that they want to focus on and engage their physicians on. In terms of the QI partnership project and what an organization or group of physicians could submit, the design is really flexible. And I would suggest there's a couple of important considerations when deciding what you could do. So one important consideration is, aligning and matching a QI project to the resources that you have available. So whether that is existing quality improvement expertise or quality improvement infrastructure to support a project, this is an important consideration when deciding what to do in terms of the nature of the QI project and the scope. I think the other important consideration is, this is an opportunity to engage physicians on a project because there will be other benefits that they can realize with their participation, not just meeting their quality requirements with us at the CPSO, but they will be able to concurrently claim CPD credits. So again, if there is something important that you've been wanting to launch as an initiative or project, some process or care change, maybe there's a quality metric that you want to focus on and improve, this program option presents an opportunity to engage your physicians on that. And to date, we've seen a number of organizations submit across the province, and I would say the majority of organizations are electing to go the route of submitting 1 or 2 QI initiatives that their physicians could sign on to. Now, certainly, if we look at organizations across the province, there is a wide spectrum of number of active staff and available resources to support a project, and we want and encourage submissions to be aligned with that, be practical and feasible for what they want to do. We do have a proposal form that you would use to guide the design and submission of a QI project. The proposal form is structured in a fairly typical QI project charter format, and this is what you would submit to us to review. So in terms of the QI partnership program, some of the key messages and benefits and considerations, for physicians, this is a quality program option, and part of the design is to try to decrease some of the redundancy in the various professional requirements that we all have as practicing physicians. So by participating in a partnership project, you can meet the requirements with us at the CPSO for a 5-year period. You can concurrently claim CPD credits, and you may be able to meet a hospital level quality improvement or patient safety requirements that you have as part of your annual reappointment. On a different level, for hospitals, for the medical leadership at an organization, we hope that this presents a great opportunity to really drive some important quality work, because you're providing an opportunity for your physicians to engage on something, and there's other benefits that they can realize with their participation. And I will pass it back to Dr. Manno to provide a summary of the current state of our quality program options available.
Thank you. We've tried to capture here along the horizontal bar the various activities that comprise the 2 streams. And then vertically, you'll see QI for individuals involves the 3 online activities that we spoke about: QI survey, practice profile, self-guided chart review, data-driven QI. QI survey, I neglected to mention earlier, is simply a description of your practice and its demographics. And then a practice improvement plan. Whereas in the group subset, you'll see that the individuals do the online activities separately and then submit one practice improvement plan. Whereas those participating in a partnership stream would be completing only the practice profile and self-guided chart review activities individually, and then the hospital QI initiative participation forms the submission to the college.
Dr. Manno,
Yes.
can you adjust your headset? We're having difficulty hearing you.
Okay, is that better?
Much better, thank you.
Voila, sorry about that. And this is in contrast to the peer and practice assessment quality assurance approach, which involves a physician questionnaire and an on-site practice assessment that could be anywhere from 3 to 5 hours in length. Next slide, please. So our experience to date has been in QI for individuals. We've been able to engage with approximately 5,000 CPSO members since 2019. We have 80 groups going in 2022. Each year, more specialties will be invited in. And another new feature for 2022 is participants have the flexibility to choose their preferred deadline for completion when they accept their invitation. For QI partnership, to date, we have 32 hospitals who have approved QI proposals going forward. Some of these are organization-wide and some are department-focused, and there's a combination of large hospitals and small community-based hospitals. Next slide, please. So when we're thinking about the overall benefits of the QI approach, there are several. This involves reflective practice. It involves goal setting on an individual or group level. It's possible to have eligibility for a large number of CPD credits, either through the CFPC, the Royal College, or MD-PAC. It means that the college can have more frequent contact with physicians and a broader impact on the quality of care overall, and ultimately a good impact in terms of public safety. Next slide. Before I hand it over to our guest, I'd just like to point out that we do have a demo available of the online activities and what they look like when you access your membership portal and click on your QI tile. However, for the sake of time today. We haven't included it in the presentation. We can come back to that if that comes up during the question period. But I'd also like to mention that we did have a previous webinar in March that was recorded, and we did look at those demo slides during that recording. So if individuals would like to go back to that recording, it's available by accessing the CPSO's YouTube channel. And with that, I'd like to hand it over now to our guest, Ms. Elisabeth Normand.
Hey, good afternoon. Can you hear me well? Amazing.
Yes.
Yes.
Great. Thank you for the nice introduction earlier. So my name is Elizabeth. I'm here on behalf of the CMPA today to present to you a program that aligns quite well with the CPSO's Quality Improvement Program just presented by Dr. Manno and Dr. Everson. So the CMPA has created a program that aim to support you in your QI initiative, but with a slightly more defined or narrow topic around test results follow-up. So for those physicians who may be wondering where to start in their practice in making these quality improvement, and here there's a focus especially on physicians who may be in a smaller individual practice or rural setting that may not have the benefit from the support of a large academic center that would have some QI specialists to assist you with your improvement. We've put together a well-structured educational program that integrates a simplified QI approach to help you make some improvement to your test follow-up system. So again, it's applicable to all practice settings, and we've seen great results so far with the physicians who have completed our program. So I'll tell you a little bit more about these two programs that work together. So next slide, please. So let's start with the test results follow-up workshop. So we have a workshop that, again, is a test results follow-up. It's a 3-hour workshop that is interactive and very hands-on to help physicians really build a more reliable follow-up system. During this workshop, we will describe the physician's responsibility for follow-up of test results. We also define what constitutes a reasonable effort when it comes to test result follow-up. This topic usually brings a lot of nuanced discussions around what is a reasonable effort and what it means in different scenarios. We then start identifying gaps and opportunities for improvement in your practice setting and think about a plan to make improvements to your follow-up system. We've been giving this workshop for around 4 years now, both virtually and in person. The feedback that we often get from physicians following this workshop is that it can be quite stressful or they get anxious since they hold quite a lot of responsibility in this complex system where they don't always feel like they have the power to make that change or enable that change to happen. So in order to assist physicians in helping them move forward, we created a Commitment to Change program where we personalize some key concepts of the workshop to your individual practice setting. And then we provide coaching and use a simplified but well-structured QI approach to help you move forward and address realistic improvements in your complex system. So our goal here is really to support physicians in their QI endeavors, targeting their practice or institution's test follow-up system. So the next slide, please. So our Commitment to Change program, it's an accredited interactive 6-month learning program where we provide a longitudinal multimodal follow-up with physician learners. And the prerequisite to sign up for this program is to attend a workshop that provides you with the baseline knowledge that you need to be able to make that change. Just to describe the program in a little bit more detail so you know what you're getting yourself into, I will go to the next slide, please. So it's a 6-step program. Again, the first requirement is that you attend the workshop. Afterwards, you can choose to apply. It's a voluntary program. So in your application, we start thinking about a root cause analysis and identifying opportunities for improvement in your practice. After you apply and you're admitted to the program, We provide you with a one-on-one coaching session with one of our qualified coaches to help you analyze your system and really identify a problem that you can address with the resources that you have, but that's also feasible. Oftentimes people come into that one-on-one coaching session and they have these big ideas of making big changes, but they're often not realistic with the resources they currently have. So we have a coach that really helps you narrow down your problem to something that you can achieve within a reasonable time frame. After your coaching session, we ask you to submit your final action plan once you've had time to think about it and reflect following the coaching session. And then we give you a little bit of time to put your plan into action. Afterwards, you come back to us in a group setting where you have one coach and 2 or 3 of your peers who have gone through the program as well to discuss your successes, how far along you were able to go with your plan, any barriers you may have had at that point. And really the discussion is around sustainability of how you can keep your momentum going with your change and get feedback from your peers. It's also a good opportunities for getting new ideas of other successful project that your peers may have done. And then we close it all after about 6 months with a final report on how you were able to sustain your change. You receive your certificate of attendance at that point, and you also get extra resources to keep your momentum moving forward with maybe new endeavors or just keeping going with your change. And the next slide, please. So both of our programs are fully accredited by the College of Family Physicians of Canada and the Royal College of Physicians and Surgeons of Canada. So the CMPA test results follow-up workshop is accredited for 9 credits for both colleges. And on top of that, the CMPA Commitment to Change program is accredited for 15 credits for both colleges again. So the test result follow-up workshop is a requirement before you can enter the Commitment to Change program, but they're both accredited separately. So you can do one without necessarily doing the other. We have 2 workshops coming up shortly. We have May 10th in French, if you're interested in signing up. And we also have June 23rd that is offered in English. In the chat, I will put the website on where you may find this information to sign up. If you do not see June 23rd on the website right away, that's okay. It's coming up. It should be there in the next 24 hours. We just released it early since we may have some interest today as well. And if you have any additional questions after today, I am available to answer anything that you may need. And I'm going to provide my email address in the chat as well. And you can email me if I don't have time to answer all of your questions today.
Great. Okay, that's great. Thanks, Elizabeth. Thanks for presenting and on those 2 programs. So at this point in the webinar, we have about 15 minutes or so remaining, and we wanted to open it up to questions. I will pass it over to Mary Bayless to moderate the question period, and we may start with some questions that were in the chat, and then we can open it up. So I'll hand it over to you, Mary.
Yeah, thanks. We have a question from Carola Collins asking about long-term care physicians who might be involved in a lot of QI projects at the long-term care home. And is there an option for long-term care physicians to use the partnership stream? Ted, do you want to take that one?
Yeah, sure. So the long-term care is just a question. Is the long-term care, is it associated with a hospital organization or is it separate? I don't know if we can get that clarification, but anyways, maybe not. So so the answer would be potentially yes. I mean, many long-term care facilities are affiliated closely with a hospital organization. So there's potential for those physicians that are doing long-term care to go the partnership route. Now, what we would outline and provide guidance on is that there should be some coordination and awareness with the medical leadership at the organization in terms of what their physicians are planning to do in the partnership stream. So that'd be one consideration. The other consideration would be, a group of physicians, if their interests were not necessarily aligned or there wasn't coordination with a hospital leadership, they could look at doing it within the group's stream. So there are, I think there's a couple of options there, and whether it's through partnership or whether it's through groups, that's something where I think it could definitely work.
We did get clarification that the Dr. Collins who asked the question, it was not affiliated with a hospital in that particular question.
Yeah, so that might be better suited through the QI groups stream.
Correct, yeah. Okay, we have another question in the chat. So just as a clarification, everyone, we're going to go to the questions in the chat first. So now we have a question from Dr. Vincent. How many physicians do you need to have for the QI partnership option? Example, a division with Department of Medicine. If you were assigned QI individual stream, can you change to the QI partnership stream? Good question.
Yeah, I can take that, Mary. So there isn't a upper or lower limit really to the number of physicians that can be on a QI partnership project. You know, based partly on the wide spectrum of physicians that are at a hospital, at the various hospitals across the province. And we have some hospitals that may have 6 to 8 total active staff, and we have organizations in the province that have over 1,500. So there's not a specific number that would that we would speak to. Again, I would coordinate what you're planning to do with someone in your medical leadership at your hospital, and we do just ask for some overall coordination and awareness of what groups of physicians are doing at that organization. It certainly could be a department level or division level submission, but again, we would work with you and your leadership on that. What was the second part to that again, Mary?
I'm just checking to, it was really about, can you switch? So if you're in the individual, can you flip over, and just so you know, we get that question quite a bit.
Yeah, so yeah, the answer, as Mary outlined, is yes, you can switch from one stream to the other. So in the short term, if you've been selected in 2022 to participate in the individual stream, if you are interested and your organization is indicating that they are developing a partnership proposal, we can communicate directly with you and essentially pause any deadlines that you have for the individuals program and transition you to a possible partnership project. So that is possible, and we would just need to communicate with you. The communication would go through our quality programs, and probably best to email quality@cpso.on.ca, but we can support that transition.
Okay, great. I don't see any other questions in the chat, but we do have a member joining us with his hand up. And I believe, let me see if I can give you your mic. If you want to go ahead and ask your question, that'd be great. I can.
Yeah, you hear me? Yeah.
Yeah.
I have a quick question. When you go through the 3 exercises, the practice profile, the self-directed chart review, and then the data-driven thing. So when you go through that, you come up with a whole bunch of ideas, and then afterwards, when you think about and you submit that and all that, but afterwards, when you think about it, you keep getting these new ideas. So are you limited to what you did during that exercise to formulate your PIP, or you can just start on another one at any time?
Well, you're a great success story if we've managed to generate all these QI ideas. Excellent. For the purposes of meeting the requirements of the college's QI program, you can choose a minimum of 2 and a maximum of 4 ideas to describe in your practice improvement plan. However, as we all know, physicians do quality improvement every day at their office. They just don't necessarily submit it to anyone in a prescribed format or get CPD credits, or maybe even any credit. But it's part of what we do as physicians. So there's no barrier to how many times you engage in the process, but from the point of view of meeting the college's requirements, the practice improvement plan can accommodate a minimum of 2 and a maximum of 4 plans.
But those a minimum of 2 or 4, those projects are not limited to the ones that you formulated while doing those exercises. You can come up with anything.
Absolutely.
Yeah, okay.
Absolutely. The exercises are a way of stimulating ideas, but very often it's observation of our own practice day to day that informs an improvement.
Yeah, exactly. Plan. Since doing that, I mean, you become more aware of your practice. And
absolutely.
Then you come up with new ideas every day. And if something
Fabulous.
new comes up, you can pick up on that. Okay.
Your poster child. Fabulous.
Okay.
Thank
and
you.
to everyone else on the audience, we did not pay him. But thank you for your comments. We appreciate them.
Very much.
I don't see any other questions in the chat, but I'm going to ask my colleague, April. April, who is our manager. April, do you see any more questions or comments in the chat?
Nothing in the chat at this time.
Is there an opportunity for members to be unmuted if in case anyone wants to, is that a word, unmute? I guess it is now.
It is, absolutely. If there's any other questions, don't hesitate to raise your hand.
Either for any of us or for Elizabeth, we'd be happy to chat. We've got a quiet group today. Probably everybody's hungry.
I don't see any hands and there's no more chat questions. Oh, wait a minute. We have one hand right now. So we have Dr. Benjamin. Let me see if I can allow the mic.
Dr. Benjamin? Maybe having some trouble getting Dr. Benjamin unmuted.
Yeah. Unless we can ask the moderator. I don't know if Josh is on the call. If Josh could see if he could unmute Dr. Benjamin.
And in the meantime, I could address the question that I see in the chat in terms of choice of charts, whether they should be acute or chronic. You're having a hard time choosing. Oh, that's a good problem to have. I would suggest choosing patient records that reflect the type of practice that you do and the range of patients that you see. So that if I were a comprehensive family physician, I might choose a pediatric chart, a prenatal chart, chronic care chart, etc. So you really can't go wrong if you just reflect the people that you're seeing every day in your practice.
We have another question in the chat, and I'm apologizing to those that have your hand up. It seems that I'm unable to unmute you. But we do have a question here from Heather, and it is a question towards Elizabeth. Are the CMPA workshops on test results follow-up recorded and available on the website? Elizabeth?
Thank you for that question. So at the moment, they're not. There are a lot of nuanced discussions that do happen during the workshop. So we are working towards a hybrid approach in the future, since we have now converted to Zoom and virtual settings, to keep that quality educational product at the same time. Just listening into a recording for us was it didn't feel as quality as we would like it to be. So we're working on that in the future. Hopefully it would be ready in 2023. If none of the dates work for you and you have a group that would like to get on that endeavor of improving your follow-up system, we offer member-initiated requests. So you can go online and submit a request for a group, and we would provide that workshop either virtually or in person to your specific group. And we often have people bringing in their administrators, nurses, admin support to really all hear that same messaging and work towards a solution together on improving their follow-up system. And we've had great success with that. So that's always an option for you.
And Dr. Benjamin, I think you see that we've put a note to you in the chat window that you can reach out to the quality team and we can help to coordinate a connection with Dr. Manno regarding setting your goals. We're happy to do that.
There's also a question from Dr. Milankovich with her hand up. I've unmuted you, so you can go ahead.
Thank you for taking my call. I would like to hear from the panel ideas regarding decreasing the volume. Do we need to keep the records of patients? We do not accept a new patient in a practice in order to decrease the volume of patients. Hello? Hello?
Hi,
Hi.
is that Dr. Bucher?
Yes,
Yes.
my question is, do we have to keep the record about or ideas how to decrease the volume of the patients?
Yes. Well, as far as the retention of records, yes, that would be according to the usual policy for retention of records, which is available on the CPSO website. In terms of decreasing the volume of patients, a lot depends on the structure of the practice, the best way to go about that. So, and in our remaining time, it may be difficult to discuss that, Dr. Bucher, but I would be happy to chat with you at a separate time about that.
Mhm.
I'll put my
And
email address in the chat for you.
We have another question in the chat from a Dr. Lisa Dalby, and she's asking, she said that she's a new employee at a clinic that has a very antiquated EMR system and having difficulty actually mining any kind of data in that EMR and looking for some advice and direction about that.
I'd be happy to respond to that. Or
Go ahead,
go ahead, Ted.
Oh, I was going to say, I mean, there's a couple options. I think that one is if it's a primary care practice, there's data available that is being pushed to you that you can access, whether that's from Cancer Care Ontario with your preventative care data, or whether it's through My Practice Report. So aside from you extracting it yourself, there is some pretty good data available to you. Another option in terms of, more broadly, trying to access what is within your EMR and extract that and make it usable. One good option is to connect with Ontario MD. They can provide some support and guidance on what they have available in terms of products and supports to assist physicians with viewing and accessing their data. And so that would be one initial step. Certainly connecting with the vendor is another option as well. Typically, vendors are making ongoing updates, or they should. It's more of a competitive space, and you could reach out to your vendor to see if there's been any updates or make a request for assistance with developing a new module or a way to view the information that you have. So those are the kind of some suggestions to start with.
Ted, I could just add that another option is to look at billing data if you're really finding that the EMR data in its present state isn't available. For example, there are colleagues that are using paper charts and do not have EMR data available, and it is possible to query one's billing program. Let's say you wanted to look at your diabetic patients and some of the care that's being provided to them. You know that you bill the code 250, your billing program can give you a list of diabetic patients. So at least you can get started with looking at some possible parameters around their quality of care. So that can be helpful too in a situation where you can't rely on EMR data. I see there's a question about the University of Ottawa, and since our time's running out, I think I'll just address that quickly.
April has
April has
replied
done
as
so.
well, but I will say that we're very familiar with the program, and definitely the curriculum designers did consult with us. So it's an awesome program. It definitely would help members, I think, work through development. So as April has noted, if the timing is a little bit off in terms of your submission deadline and participation in that course, don't hesitate to reach out to us and we can coordinate that with you a bit better.
I see Elizabeth has her hand raised.
I would just like to add, if I wasn't clear, I forgot to mention it, that our all of our programs are free of charge for the CMPA members. If that wasn't clear, it's the programs are free.
Good to know.
Okay, so I think that we're at time. We're at 1 o'clock, so I think we'll finish up. Again, thanks to everyone for signing in today. We hope this was of value to you in terms of understanding the changes that we've made and some of the resources and supports that are available to you to support doing QI. As mentioned, this is recorded. It will be located on our website as well, in addition to the webinar that we did in March. And as Dr. Manno mentioned, there was a demo with that webinar. So some good resources that are available on our website that you can access. But again, thanks for attending today. And as well, don't hesitate to reach out to us directly if there are any other specific questions. Thanks, everyone.
Thank you.
Bye.